Hello, this is Dr. Bouvier with Dr. and You. You've come here to learn a little bit more about a pearl of wisdom. And today we're talking a little bit about prostatitis and a little of the ins and outs about how we can get rid of it once and for all with people. With me, I've got one of my patients here, and he's been around for many decades. We're not going to let's say more than 60 years. And so
more than 80.
And he's consented to talk a little bit about prostatitis and what he's gone through. And really, if you think back, probably for years now, you've probably had a little bit of a smoldering infection. And you mentioned something to me today that you were on the antibiotics for a couple of weeks, 3 weeks, and you felt better. You had energy, and things were going better. And then you got off the antibiotic, and now things are starting to slow down a little bit. And then that was reported actually by your wife. So it's good that she came today to get the other side of the story, right? Which is another pearl of wisdom. Always bring the wife in so we get the whole story. And so that gives you a clue from a clinical standpoint that there's a long-term infection that's going to take a little bit longer to get rid of. So we've got a plan of giving him one of the antibiotic. Actually, this time it's going to be Bactrim, but we've also used doxycycline and a couple other antibiotics long term, but this time it's going to be 1 a day dose of Bactrim for 6 weeks, and we might even extend that for a total of 3 months. We'll see how he's doing in 6 weeks, but I expect after a longer term, and many times it's up to 3 months that we have to use the antibiotic for. So when you're treating prostatitis, consider that the textbook doesn't have the whole story, and you may have to be treating this for a longer period of time. And people give that little history like we talked about earlier. So the pearls here, the take-home points are, number one, consider it in men who are kind of sluggish, older, and have no other reason, no cardiac reason, heart reason, brain reason, liver reason, kidney reason to have that sluggishness. Consider chronic prostatitis as being part of that deal, and the treatment for that could be as long as 3 months. The second take-home pearl, which you've probably heard before, is always bring the wife in for a second opinion. This is Dr. Robert Bouvier with Dr.
This is first opinion.
This is first opinion. Oh, that's right. We got to give credit due. She's first opinion. Okay. Again, this is Dr. Robert Bouvier with Dr. and You with a clinical pearl. Thank you.